Hi, everyone. Last year, if someone is here, I talk about osmolarity. It was around 6 month experience. Now I have one and a half year experience, and we are collecting data before the cataract surgery, before refractive surgery, 1 week after the cataract and refractive, 1 month, and 3 months. It's big data, and I hope that we can reach huge data for osmolarity. I will highlight a lot of things, but let's see. In 2024, osmolarity test, which is the current quality of vision. We are changing worldwide, and we are going to see how even the societies put osmolarity in everything nowadays. It built on the dry eye foundation. It's a base business and best practice for dry eye, and all these centers for dry eye centers or the hygiene nowadays for the eye should put osmolarity as a test before any refractive cataract surgery. Either they are using monofocal plus, EDOF, trifocal. You can have a premium IOL patient, 1 month postoperatively, he's perfect. He's 20/20, but the patient is unhappy. He's seeing 20/20, but he's always complaining, I am not happy with 20/20. If you are setting your concept, setting for a premium vision, you should have what's missing. What's missing is you are going to put visual acuity, amazing biometry, you don't have an error, you have the best IOLs in the market, phaco machines, aberrometry, femto, everything. But still, you need to have testing osmolarity. Why? Because defect in the ocular or making the tear film unhealthy with a toxic osmolarity. Toxic osmolarity means damage of the corneal cells. High osmolarity or toxic tear film impact on the eye. How? Toxic hyperosmolarity damages the corneal cells and drives refractive surprises, destroy the epithelial cells, drives inflammation, damage corneal nerves, and drives refractive instability. So if you didn't measure or control the tear osmolarity as a hidden part in the tear film testing, you are missing a lot. The higher osmolarity leads to unstable tear film. So the tear film instability is potentially affecting vision. How? This is the normal tear film during blinking, and when there is a hyperosmolar, leads to unstable tear film. Hyperosmolar unstable tear film means the vision will not ever be good, because light scattering effect in the hyperosmolar tear film results in fluctuating visions. How? The hyperosmolarity is a more common than anyone can think. Nearly cataract patients, 60% of surgery, you can go perfectly with your cataract surgery, and we have everyone here did a wonderful cataract surgery, and a lot of people facing 1 week come to your clinic, I'm 20/20, but I'm not happy. And no, you are telling the patient you are crazy, go to any psychiatric or any, you are perfect, you don't know error of refraction, everything is perfect. Why we do test nowadays? Because when you have a grade 3 cataract surgery, it's resemble like you have a toxic tear film osmolarity. Typically, with the hyperosmolarity, resemble there is the same as light scattering if you have a nuclear cataract grade 2 and 3. The same way of scattering. 56% of the asymmetric cataract patients have abnormal tear film osmolarity. And using with this scheme, if you have a symptomatic patient, you divide into normal osmolarity and high osmolarity. With the high osmolarity, it's confirmed dry eye disease. And track the patient to treat to establish the osmolarity. If it's normal, a line for another like anterior blepharitis, allergic condition, a lot of things. It's not a dry eye disease. And a lot of people worldwide are doing nowadays the testing. And for cataract patients, if you are going to go for a toric IOL or toric multifocal IOL, if you didn't control hyperosmolarity, you are going to face a lot of astigmatic problems post-operatively. You are going to find the axis of astigmatism is different than before. Or even in the quantity of the touricity, it will be different. And they found 1 in 5 will have a problem in the astigmatic preparation for the patients. The same, it's uncontrolled. You are going to see the same vision like this. And this is why there are worldwide now, put it in every, since 2015, the Geogran Foundation highlighted the tear osmolarity. 2017, TAFOS and DACE2 highlighted that osmolarity is the core mechanism in dry eye disease. 2016, also the CDRC in America, the group, said that the tear osmolarity assessment is a helpful tool for diagnosis of dysfunction tear film syndrome. 218, the American Academy directly said that elevate the osmolarity and or increase the eye differences. And 2019, the ASCRS announced that the tear film osmolarity, it's a mandatory for pre-cataract and refractive surgery. You should know that the numbers up to 310 to 20 is okay. More than this, it's a toxic. And a simple machine, because of the time, I will go to finish this. And why osmolarity now? Because osmolarity testing is essential and identification for the patient to prevent any abnormal finding you can find after cataract surgery. Thank you so much.